It is a real pleasure to be here today. And I can actually see that Emily is in the audience. And I want to thank Emily for sharing her story. I, as an adult with a different rare disease, really resonated a lot with what you said, Emily. And I think what I'll be presenting about today will really follow up on a lot of the important points that you made. Um, so, as Louise mentioned, I am an associate professor at Oregon State University, and I'll be talking about the distinctive challenges that adults with rare diseases face in terms of mental health. So I want to start by kind of thinking about where CLAs fall in kind of the broader spectrum of diversity. So, as we all know, there are many ways to be unique and diverse in our world. Within the kind of spectrum of diversity is disability, right? That is one type of diversity. And then within disability is the group of people who have rare diseases. And of course, CLAs are rare disorders. And I also want to introduce that I have a rare disorder. My rare disorder is Mobius syndrome. And so the thing that really drew me to do the work that I do, which is to research and advocate for mental health in the rare disease community, was my own experience having a rare disease, connecting with my Mobius syndrome community, and then connecting with the broader community of people with rare diseases. As I'll discuss in the coming slides, there are some interesting commonalities that people with very different biological processes of rare diseases experience. And a lot of times those commonalities involve mental health challenges. I also want to highlight that aspects of diversity, disability, and rare diseases can vary in how visible or apparent they are to other people. And I understand that CLAs also can vary in whether they have symptoms that are obvious to other people or not. My rare disorder, Mobius syndrome, is primarily characterized by facial paralysis. We were born with our facial paralysis. So we are more on the visible spectrum, and it's very hard to hide something that is very obvious on your face. And I'll talk later about some of the implications of having a visible versus invisible disorder. They both come with their own unique challenges. So I just want to say solidarity with you all. I have a different rare disorder, but I think in many ways we are all advocating for the same thing. This is a picture of me and some young people from a Mobius syndrome conference. So what are rare diseases? So in America, rare disorders or diseases are defined as conditions that affect fewer than 200,000 Americans. However, rare diseases or the experience of having them can actually be considered common because 1 in 10 Americans has some sort of rare disorder. There are more than 7,000 different identified rare disorders. So we know that, while there are very different disease processes, it's helpful to kind of think of rare diseases as a collective that we can advocate for. So these are this is a slide that my students prepared. I educate students about rare diseases and challenges, and I thought these are some really powerful stats. So there are more Americans who live with a rare disease than all of those who have either HIV, heart disease, or stroke. And only 5% of people of rare disorders have an FDA-approved treatment, right? So that is 95% of rare diseases who do not have an adequate treatment. So I'm a psychologist, and so my work focuses on the mental health aspect of rare diseases. And I've been very interested in commonalities that we experience across the spectrum. So although a medical doctor might say that there are very different, disease pathways across the 7,000 rare diseases, I, as a mental health researcher, would say there's actually a lot in common across those differences. So I'm going to share some universals that we found in our research. So first is the need for specialized support. We know that there is an average diagnostic delay across all rare diseases of 7 to 9 years, right? That is a very long time of searching for answers and treatment, and coming up with something that is not appropriate. We also know that 2/3 of people with rare diseases feel that they do not get sufficient informational, social, and psychological support through the healthcare system. And let's say a little bit more about support. We can focus on social support for a minute, and psychologists actually identify 4 types. So to have a strong psychosocial quality of life, you want to have aspects of all of these. So companionship support is having other people around you who make you feel like you belong, that you're part of a group and part of a community. Emotional support is having people who help you feel understood and validated. Informational support is having people or perhaps an organization like LGDA that can provide useful knowledge about, in this case, managing a rare disorder. And then tangible support is support that involves helping with basic everyday needs. So are you able to have your needs met, to have a clean home, to have groceries, to have financial support, and all of those things? So I want to turn now to 2 other rare disease universals that we found. So there's stigma, which stems from largely a lack of public awareness, and also from the lack of awareness in the healthcare community. And this can sadly result in blame, in minimizing people with rare diseases experiences, and also discrimination, both interpersonally and at a systemic level. Like Emily was describing, the challenge of finding employment that not only can accommodate you, but also doesn't surpass the federal limits that would cause her to lose her health care. So I want to share a quote from our research. Because my main symptom was excessive sleepiness, people in my life told me to grow up and that everyone's tired. I cried happy tears when I got my diagnosis because it validated years of self-doubt and struggle. And I imagine that people watching this webinar can relate to that experience. Similarly, we experience isolation because it's unlikely that we would encounter others with our condition in our everyday lives unless we intentionally seek them out and go to great lengths. So here's an example quote. I want to feel that I'm not the only one struggling with the obstacles that I face. So I'm going to talk about a study that we did recently in wow, what is the date? 2022. The pandemic really did a number on telling time, didn't it? So this study, we believe, is the largest study of adults and caregivers with rare diseases or supporting people with rare diseases in the United States. And we intentionally took a disease-agnostic approach where we wanted to include as many different rare diseases as possible. And we ended up with 344 different diseases represented. And in case you're wondering, some of the most frequently represented were spinocerebellar ataxia, idiopathic hypersomnia, narcolepsy, and Ehlers-Danlos syndrome. There were a few people with CLAs represented in our sample. And we conducted a primarily internet-based survey, although mailed copies were also available. And we measured, really important things to mental health, like health-related quality of life. That included anxiety and depression, as well as fatigue, pain, sleep, and ability to participate in social activities. We also looked at people's experiences of stigma or discrimination, and we looked at patient satisfaction. And overall, we found that a third waited more than 4 or more years for a diagnosis. 1/2 experienced 1 or more misdiagnoses. 2/3 felt that they had insufficient psychological support. And they had significantly poorer quality of life and greater stigma on all the scales that we measured compared to the US population norms. And we probably wouldn't be too surprised by that in the rare disease community. What I would point out is especially interesting is that people with rare diseases also had poor health-related quality of life and stigma compared to people with common chronic conditions. So this really does point out that there is something uniquely challenging about being rare and having a disorder versus being common and having a disorder. So to dive more deeply into these findings, we also found that there is kind of lukewarm patient satisfaction. We were interested in seeing what led people to be more satisfied, and we found, unsurprisingly, that if they experienced a shorter diagnostic odyssey, if they experienced less stigma, less pain, and better physical functioning, they're more satisfied with their healthcare. We also found high anxiety and depression in both children and adults with rare diseases. And again, we were interested in things that might protect against anxiety and depression. And in this case, we found that when people experience less stigma or discrimination, less fatigue, less sleep problems, and a more stable disease course, they had better mental health. And I find these results kind of promising because some of these things are malleable. Some of these things are like low-hanging fruit. We can help people manage sleep problems. We can help people manage fatigue with some evidence-based treatments. And we can also reduce stigma at the structural and social level for everyone with rare diseases at the same time, while medical professionals and scientists go through the longer process of understanding each individual disease process of the 7,000 different conditions that we have. So we've also done research kind of looking at the broad rare disease community, again, hundreds of different types of rare diseases represented, and looking at kind of, are there meaningful facets or dimensions within the community of rare diseases that have differential effects on mental health? And I want to share some of those findings now. So I also want to acknowledge that I understand that CLAs are very diverse in their presentation. And so even within the CLA community, you will see variation that will help you to understand some of the mental health challenges. So one of the first things we noticed was that the age of onset matters a lot. Some people are born with their conditions and with their symptoms present at birth. Others may have their symptoms present much later in life. We actually find that people with symptoms earlier in life tend to have some better mental health outcomes. And we think that is because they have had the opportunity to integrate their rare disorder into their identity and go through their initial development with their condition. It also helps people to develop what we call disease self-efficacy. That is, if you grow up with your condition and hopefully your caregivers have helped you to learn to navigate it, you feel more confident in managing the challenges that your disease brings up. People who acquire their condition or their symptoms later in life may feel that their identity has shifted or they've lost their identity and they have to find a new one, as well as change their way of functioning in the world. As I alluded to before, disorders can vary in how visible or noticeable they are, and I know this is the case with CLAs as well. We find that either way can be challenging, but they have different kind of experiences of being challenging. So people with visible rare diseases like me have kind of face immediate stigma. It's not possible to hide a very visible condition. And so this makes people perhaps more prone to experiencing staring and comments and immediate discrimination in a context of applying for jobs or dating or creating social relationships and things like that. However, we see that people with more invisible disorders experience a different kind of stigma. And that was kind of captured in the quote that I shared earlier, where you have some challenges that are not apparent to others, and especially because rare diseases are not well understood by the general public, they may not believe you when you say, you know, I have this disorder or I have these particular challenges. They may think that you are not being truthful or that you are over exaggerating, and this can be very hard to get treatments, to get accommodations, and people can feel really invalidated. Another important facet is the course of the disease. So diseases can range in kind of the timeline that they show. So some diseases are progressive, meaning they get more severe over time. Some are stable, where once you kind of develop your symptoms, it's going to stay the same over time. So it's pretty predictable. This is found to be a pretty a type of presentation that can be associated with good mental health, because once you learn how to manage your symptoms as they are, they remain predictable. Other conditions can be episodic, right? They wax and wane, they come and go. This can be very challenging because it's hard to predict when it might occur. It's hard to make plans. Other people may not know what to expect from your presentation and abilities from the day-to-day. And then there are also disorders that can improve over time. And then I also want to note that there are certain symptoms that can be especially challenging for mental health, and those include pain, fatigue, and physical functioning. And that is because these conditions, of course, involve discomfort, and they also involve limitations that can interact with the way our society is built. So I want to talk about an example of how we can support people with rare disorders. And so the work that I will present here is focused on my own rare disorder, Mobius syndrome, but it has inspired some other research that looks at different types of rare disorders as well. So we know that people with rare diseases and their families want to meet others with their condition, but unfortunately, most have never had the opportunity to do so. Some rare disease organizations are, making efforts to help people connect. And I know LGDA is doing things like that with this webinar series and with conferences. So is the Mobius Syndrome Foundation. They've been holding biannual conferences every 2 years, and this is the opportunity for people from around the world to come together and be in a space with others who look like them and have the same experiences for often the very first time in their lives. So we wanted to study what the experiences of people who attend these or don't attend these were. And so a few years ago, we surveyed people who did and did not attend the Mobius Syndrome Foundation conference. And we surveyed them 1 month before the conference and 6 weeks after. We used standardized measures of things like stigma, self-efficacy, and social support and knowledge. And we also asked open-ended questions about their perceptions of their experiences. So first, in our quantitative analyses, we were able to see that there was change among people who attended conferences and who attended more conferences. So we saw kind of different benefits for different communities, different benefits for adults versus parents. So with adults, we found increased social support, reduced feelings of stigma, and increased knowledge. In parents, we saw greater rare disease self-efficacy. So again, that is greater confidence in managing their child's condition, as well as increased knowledge. So we thought that these findings made a lot of sense, given that Mobius syndrome is a congenital and stable condition. So parents are usually the ones who need to go out and find the information about how to manage the child's condition, whereas adults who are attending the conference likely have already learned how to manage their symptoms and are more interested in getting that social and emotional connection. And I want to share some quotes from our open-ended responses as well. We definitely saw a lot of themes about stigma and social support. So one adult said, "It's the rare place where I feel normal." And I found out that there are a ton of people out there who understand me. Role models were also a really helpful thing to come out of the conferences. A parent said it was really encouraging to meet adults who have Mobius syndrome and to see the young adults and teens, knowing that our kid would be okay, that he'd grow up and be successful. And then almost in response to this quote, an adult with Mobius said, "I enjoy and embrace being a silent role model for parents and kids." So it does seem that having this opportunity to connect, in this case in an in-person conference, can be very beneficial to adults and caregivers. We're now exploring other avenues, right? Because it can be quite challenging and expensive to travel around the world to connect with others who have a condition that is not very common. So we do think that there are benefits in Zoom connections and in other creative ways to connect with people. So now I want to switch gears a bit and invite people to think about how they share or don't share information about their condition with others. Some of my recent work has been really interested in the experience of adults with rare disorders in being expected to disclose or explain about their condition. And as I mentioned earlier, this can vary based on whether you have a visible condition or an invisible condition. if you have a visible condition, you may walk through the world and attract curiosity and stares and questions. For example, people in my community often get the lovely question, "What's wrong with your face?" And so we then need to kind of think about whether or not we want to explain or maybe even preempt curiosity. Now, people with invisible conditions also face uh, decisions about whether or not to disclose because they may want others to more fully understand their experiences. They may want to get support and understanding, and they also may need to disclose so that they're able to get their legal accommodations and protections. So in our work, we've kind of found three different styles that people tend to use when choosing whether or not to disclose. And these styles can range over different contexts. They can range depending on who you're talking to and kind of what life stage you're at. So the first type is what we call compelled non-disclosure. This is where people feel forced to disclose or not disclose their condition. And so there are a number of kind of different subtypes here. So in some cases, people feel they're in a situation where they can't get away and someone is asking them, why do you look that way or why do you move that way? And they feel like they are obligated to respond. In other cases, they may have been told by, maybe a well-meaning family member or a friend or someone they know that they should not ever tell about the condition that they have, and they feel forced to not disclose. And then a third type is unauthorized disclosure. This is where someone tells another person about your condition, but you didn't want them to make that disclosure for you. So unsurprisingly, all of these types are experienced as unwanted and harmful. This is not a pleasant way to experience disclosure or non-disclosure. Kind of in the middle in terms of pleasantness and mental health outcomes is what we call autonomous non-disclosure. So this is where people feel that they do have control over the situation and they have chosen to not disclose. So this can look like a range of things, including avoiding any situation where your disorder might be noticed. This could involve concealing your disorder. It could involve actually giving a confabulated reason for your disclosure rather than for your disability, rather than the real reason. And it can also include selective disclosure. So choosing to disclose to certain trusted people, but choosing not to disclose to others. And then finally, the last type is open disclosure. So this is where people are really open to talking about their condition with anyone. And this can include what we call indiscriminate disclosure. They're fine with answering questions with other people disclosing for them. And then the final subtype is broadcasting. And this is where people are actually choosing to disclose for what they would feel is the greater good. So here they are attempting to educate the public, maybe via social media, maybe through presentations or advocacy, as a way to reduce stigma and increase support for people with rare disorders. So all of these, I want to emphasize, are normal, and probably most people with a rare disorder have experienced most of these types. We have found that the most common approaches are selective disclosure and indiscriminate disclosure. And the ones that are generally more related to positive mental health are the ones that are most common, plus broadcasting. So thankfully, we actually see that as people kind of age and grow up, that they tend to move towards selective disclosure and open disclosure strategies as they get older. So people may be, through trial and error, finding strategies that are healthy for them. So now I want to change gears to talking about different strategies that people can use to support their mental health. And I'm going to start with kind of the most basic that everyone can benefit from, and move on to strategies that could be used if you're experiencing more elevated mental health concerns. So first, we can talk about the 5 areas of self-care. And it's helpful when we talk about these 5 areas of self-care to kind of evaluate what you are currently doing, and perhaps if there is anything you would like to change or amplify. So first, there is physical self-care. So this is ensuring that you have sufficient nutrition, exercise, sleep, and personal hygiene. There is emotional self-care. So evaluating your self-esteem, how you feel about yourself and your accomplishments, and whether you're enjoying the activities that you're engaging in. Psychological self-care includes the status of your mental health, spiritual practices and meditation, those things that Emily was referring to as so helpful. This can also look like keeping a journal or a blog to kind of help understand your experiences. And this can also include learning new skills and being adaptable and persistent. Social self-care involves having quality time with friends and family, and attending social groups and events, and having hobbies that involve connecting with others. And then finally, professional self-care involves feeling that you are able to manage your work duties and have a work-life balance, and also have sufficient finances. So again, it's helpful to every now and then take stock of kind of where you are in these facets and see if there is anything that kind of needs some extra care. Now, if you feel that you may have some concerning mental health symptoms, I have some strategies for you to learn more about whether or not you might be at risk for some common mental health conditions. So here I have 2 links that will give you some well-validated screeners. So these are short multiple choice questionnaires that you can take that will give you a sense of whether you are at risk for depression, PTSD, substance abuse, alcohol abuse, and anxiety. So these can be accessed through the American Veterans Association, although you don't have to be a veteran to access them, and also through the Anxiety and Depression Association of America. So if you are kind of wondering where your mental health stands, this is a good place to start. They will not diagnose you with a condition, but they will tell you if perhaps some of your symptoms may be worthy of talking to a mental health professional about. So if you choose to take some of these surveys and you're concerned about your answers, there are a few steps that you can take. So first and foremost, anyone at any time, literally 24/7, can contact or dial 988, which is the New American Suicide and Crisis Hotline. This is free, it's confidential. At any time, if you need support or help finding resources and you don't know where to turn, you can simply dial these 3 numbers. So this is not meant to be kind of a long-term therapy situation, but it's meant to be somewhere that you can go if you are if you don't know where else to turn. Um, and it is especially important, of course, if you are having thoughts of suicide, to contact this number. But it's not just for that. It can be if you are feeling very upset or distressed by something that has recently happened to you. Again, this hotline can help you. Now, um, a longer term solution, a solution that we really hope that people can take if they have mental health concerns or a diagnosis, is to get some mental health therapy. And there are many different types of therapy, and I want to highlight two that are they have a strong evidence base for use in people with chronic health and rare disorders. And the first is cognitive behavioral therapy, or CBT. And this is focused on reducing avoidance of social interactions or of activities that you might be afraid of. It involves strategies for anxiety management and challenging negative self-thoughts that you have. This actually ties in nicely to what Emily was saying around taking responsibility for your thoughts, and understanding that you are able to control your thoughts, but not necessarily some of the other things out there in the world. Related to that, is acceptance and commitment therapy. And this is kind of like the next stage of cognitive behavioral therapy. It builds on it. So ACT essentially says we need to accept your reactions and feel your feelings, be aware of them, be mindful, recognize what you can change and what you do have control over, take responsibility for that, but also accept the things that you are not able to change. Focus on the things that you value the most, that you have goals towards, and choose that direction and take meaningful actions in that way. So these are two therapeutic approaches that you might look out for if you're looking for a therapist. And then if you are looking for a therapist, in addition to connecting with your local community, there's always a good idea to start with your primary care provider who might be able to refer you. Sometimes it's hard to find a therapist, though, especially a therapist who might understand the specific challenges of having a chronic illness or a rare disorder. So I have a couple of tips. So one resource is going to Psychology Today. It has a find a therapist search feature, and you can refine that search by clicking on issues and then select chronic illness. And this will pull up therapists that have a specific expertise in some of the challenges we might experience as people with rare disorders. And the other resource is the American Psychological Association Psychologist Locator. So again, here you can search and use a refined search feature to click practice areas and search chronic illness and or disability. And again, it'll find people with a specialty in those areas. So I want to conclude today by really highlighting, right, that rare diseases make us unique, that we have some shared challenges and also shared resilience. You'll see a picture here of me and students from my lab a few years ago. We did a Rare Disease Day event where we raised awareness about rare diseases by having having activities in our quad at Oregon State. And one of the things we did was invite people to think about what makes them rare. And for some people, it was a rare disorder. For some people, it was, unique interests and skills. And, for people with rare disorder, it's both. So we do have these unique resiliences and expertises, and being able to connect with others with either your specific rare disease or with different rare diseases, all under our umbrella of rare diseases, can be really helpful, right? We can leverage the unique skills and expertise that we have developed to help each other. So thank you so much for being here today. Here is some information if you want to connect with me. If you are a QR code person, this will take you to all of my links. I also want to highlight that I have a blog on Psychology Today where I often write about issues related to mental health and rare diseases in an accessible way. So if you're interested in the things I talked about today, you can learn more there. So thank you again.